afternoon. My name is Ashley, and I'm here with Dr. Tassone, an orthopedic surgeon and clinical vice president of surgical services at Children's Wisconsin. He's here to answer some questions today about surgeries and procedures here at Children's Wisconsin during COVID-19. Thank you for being here, Doctor.
Thank you.
We'll be taking questions throughout the video, so please feel free to ask those in the comments. Before we jump into questions, Dr. Tassone and I want to emphasize that Children's Wisconsin is here to help you with your child's care, even during COVID-19. We've taken a lot of steps to make sure that patients, their families, and our staff are safe during COVID-19. Dr. Tassone, do you want to talk through some of those steps that we've taken in the hospital and in the OR?
Sure. So going all the way back to when we really didn't know much about COVID-19 and what this pandemic was going to be in Wisconsin, we took fairly dramatic steps in the operating room. We actually took everything back to a point where we were only doing emergency surgeries, things that were truly life and limb. And we did that until we got a better understanding of the disease and an understanding of how we could provide care safely here at Children's. And then we opened things up a little and are doing what we talk about as time-sensitive surgeries. In addition, and we'll talk more about it, but you can tell the way that we're dressed. We're wearing more protective equipment. We are screening our patients. We are trying to communicate with patients in novel ways, utilizing telehealth and other things like that. All in all, the number one priority for us is to make sure our patients and our staff and our families are all safe, and we are accomplishing that every day here at Children's.
Yeah, so one of the examples he mentioned is that we are wearing PPE, or personal protective equipment, that's appropriate for certain areas of the hospitals or depending on who you're around. Don't be alarmed if you come to the hospital and see people dressed like we are. It's just taking the precautions necessary for COVID-19. In fact, actually, if you're planning on coming to the hospital, it's a good idea to potentially show your child this video so they can better prepare for what they're about to see if they go to a Children's Wisconsin location. Dr. Tassone, can you talk through what we're wearing right now and why?
Absolutely. Yeah, so right now Ashley and I have on our standard surgical masks. These are a baseline level of protection. They're what we used to wear when we were doing surgery. It would be a mask like this. Because Ashley and I are performing our appropriate 6 feet of social distancing, these are the masks that we wear. If in fact, and we're not providing any direct patient care. When we're closer to each other, not able to abide by the social distancing rules, or providing patient care, then we take it up at least one level. This, I'm sure everybody has seen in the media, the N95 masks that were a hot commodity and hot topic. This is an N95. It's just one level higher of protection for patients and for the staff and providers. There are even higher levels. Between Ashley and I is something called a capper, and that's sort of a next level. You feel sort of like an astronaut when you're wearing that. But there are a variety of levels of different PPE, and we have thought through exactly what is the right PPE to wear for the right person in the right place at the right time, again, to make sure that everybody's safe, the patients, their families, and the staff.
Yeah, so something to note right now is because of where we are, which we'll talk about in a minute, we are wearing majority of things that can be laundered overnight, and we can talk a little bit about that. And then he talked about the different masks. The mask we're wearing now is not the N95 that we've heard a lot about in the news. So we've talked through what staff would be wearing for personal protective equipment, but what about patients?
Patients and families, because we have from the beginning of this situation, we've been trying to follow CDC guidelines, and right now the CDC is suggesting that when social distancing situations, staying at home isn't possible, that everyone should be wearing a mask of some sort out in public, even a cloth or homemade mask. So we're hoping that everyone will wear a mask, patients, families, staff, and providers. And we will provide patients and their families masks when they need to come to Children's if necessary. But by all means, because all of these resources are things that we're trying to be very cautious with their utilization, if families have their own masks, cloth, or homemade, please feel free to also wear those.
All right. Now, can you explain exactly where we are?
Yeah, so the Facebook Live, I will admit to being someone who doesn't have a lot of Facebook experience. The last time I did one of these Facebook Live, Corey and I were standing right over there, and we didn't have to wear masks. There's not any surgery happening, but we're in one of the ORs here at Children's. We're in OR 3. This is our trauma room. So once we leave this room today, this room will be ready in case a trauma situation occurred, but before tomorrow they would be able to rush a patient into this operating room and provide the appropriate care for them.
And before a patient could come in here for surgery, any OR, not necessarily the trauma OR, what would need to happen?
Yeah, so first and foremost, we are still in a scenario here at Children's where first is the surgeon, the provider themselves, is deciding who really needs surgery, and it needs to be done in a timely fashion. And then there is a surgical executive team that is secondarily reviewing all of the surgeries that are happening at Children's to make sure that we are doing the absolutely important and necessary surgeries right now, because we're still taking this pandemic very seriously, and we're taking into consideration the resources that get utilized during surgery. We're taking into consideration all of the exposures that happen by being at Children's, and we're making sure that everything we do is absolutely necessary, mandatory, and time sensitive. One of the other ways that we're protecting the patients and the providers and staff is that we were a pioneer in the country in terms of all of the patients that come to get surgery here are actually having a COVID test 24 to 48 hours before their surgery. So one of the things that you would be asked if it is determined that your child needs surgery is you would come to the hospital 1 or 2 days before to get a COVID test. We would then make sure that the patient did not have COVID-19 before the surgery.
All right, but what if a trauma happened? For example, a kid got in a car accident and needed to have surgery right away. What would happen?
Yeah, so that was a hot topic for us early on in this, because obviously that happens here at Children's, and we know there are emergencies. And so thank goodness we have such a great infrastructure and great resources that what actually happened was down the hall that way, what used to be our routine OR5 was actually retrofitted to turn it into a negative pressure room. And what that means is that instead of in a normal OR like this is positive pressure, where the airflow sort of pushes the air away from the patient to keep the center of the room as sterile as possible, but then obviously that air goes out into the hallway. A negative pressure room, the air is maintained in the room. It still has the appropriate flow, so there's no increased risk of infection to the patient, but it makes sure that if there is an airborne virus, that it doesn't go out into the area around the operating room.
Very interesting. Okay. During COVID-19, what concerns you and your team?
Yeah, the same thing that concerns every parent watching this, every patient in the rest of our community, it's the safety of the kids. And the way sometimes that we need to keep our kids safe is actually by something counterintuitive, which is bringing them into the hospital and doing surgery. So we want, the providers are thinking through these, the surgeons are making sure that children that they recommend surgery really need the surgery, and we want them to get the surgery that they need. So what worries me is that there are circumstances out there where people are so worried that they are trying to avoid healthcare systems, which is frankly quite rational, but we are doing so much here to make it safe that we want to make sure people are getting the appropriate surgery that they need.
Okay. What would be an example of a surgery that shouldn't be delayed, or a situation in which a family would be prompted to come in?
Yeah, I would really actually just say it very generically. On the surgical executive team, we are truly trusting our providers here at Children's. Every single provider at Children's Hospital cares so much about the kids that they're going to tell families that a surgery is necessary if it is. Examples of things that we're doing: there are still spine surgeries happening, there are heart surgeries happening, there are appendectomies happening, there are surgeries happening here every day, because at the bedside, providers in the clinic are determining these kids need the surgery, and so we're still doing the surgery that has to happen.
Sure, and actually Dr. Tassone just got out of a surgery, so we very much appreciate him taking the time to be here with us. This is something we're also seeing in our primary care locations, that families are delaying important vaccinations because of the fear of COVID-19, and we are going to have a full conversation about that with a primary care doctor later this week. Are there any other ways in which your team has adjusted during this time with COVID-19?
We have reinvented the way we do things almost every day. Some of the things are we have started to utilize telehealth, which I'm candidly quite excited about. I think it's going to be a whole new avenue for us to interact with our patients and help patients from further away and take care of them. We are changing the way that we dress. You would experience one of the things, the first thing as a family or a staff, when you show up to the hospital, you no longer just get to walk into the hospital. One of the first things that happens is you get screened at the door, and that is for families, patients, providers, and everyone entering the building. Someone at the door will make sure you're appropriately wearing a mask. They're going to take your temperature if you haven't taken your temperature that day to make sure you don't have a fever. They're going to talk to you about your symptoms, and we really are going to make sure that everyone entering this building is doing so in a safe way and a healthy way to keep everybody healthy.
Yeah, and that's something interesting that you noted there, that staff on their way in every single day are being just asked questions about their temperature and whether or not they're wearing the right mask, and we would give them the mask if they,
Yep.
And then families the same thing. We have masks that we might be giving family members.
Exactly.
Okay.
We know this is important. We're taking very seriously the spread of this disease, and we're doing everything we can to prevent it.
Okay. Is there anything else you want families to know about Children's Wisconsin?
Yeah, I could go on, but what it really comes down to is, as a surgeon and with all of my colleagues here, we know what a big deal it is for families when we tell them that their child needs surgery. And it's even a bigger deal right now because of the fear in our community about this pandemic. And so we don't take lightly. We take it very, very seriously when we recommend surgery, but we also, when it's recommended, it's important that it actually happens. So I really want people to realize that it is very safe to come here. It's arguably one of the safest places you can go outside of your home because of all the steps that Ashley and I have talked about over the last several minutes. And we will make sure you get through here safely, you get the necessary surgery so that you can start to recover, and that there aren't worsening complications from delaying or not having the necessary surgeries.
So we did get a couple questions before the Facebook Live started, so we'll jump into those. So surgeries that were delayed or rescheduled, do you have an idea of when they might be starting up again?
It's interesting because what a month ago was deemed as not time sensitive, all of a sudden now a month later it could become time sensitive. So we are utilizing the same criteria to determine the necessity of surgery we've been talking about all along. It's, will there be a functional decline if we don't do surgery? Are there risks that will occur if we don't do surgery? Will there be resource problems if we don't do surgery? For example, a child needing more and more antibiotics because they get more ear infections because they didn't get ear tubes.
Mm-hmm.
So it really runs the gamut of what we're doing, and we're doing everything to prevent further problems.
Okay, and that would be up to the doctors, the surgeons,
Absolutely.
and dependent on each case,
Exactly
right?
right.
Okay. So someone had asked, it's very similar, it might be a very similar answer, but when's a safe time to reschedule a surgery that's been delayed?
Again, we will not do something here at Children's that isn't safe. If your surgeon suggests now's the right time for your child to have surgery, it's safe. We would never consider bringing a child into this building if we weren't sure that what we were doing was safe. That is always our primary initiative.
Okay. All right. It looks like we have some questions from the comments.
Sarah in the comments asked, are we limiting family members from coming to the surgery or staying with the child afterward?
Thank you for bringing that up. And again, in the spirit of social distancing, we do have a visitor restriction. We are having one family member with each patient coming in to have surgery. And we understand that your child having surgery is a scary thing. It's a very big deal. And we wish there was a way that we could safely have all the family members come. But we really are trying to be thoughtful about making sure that we aren't an issue with spreading this disease. And so I appreciate you mentioning that. We do limit it to one family member.
All right. Thank you again, Dr. Tassone.
Of course, thank you.
If you have any questions about Children's Wisconsin or COVID-19, please visit chw.org/coronavirus. We have a variety of resources there, including things like blog posts about how to talk to your child about COVID-19. And we want to emphasize that we are here for you to help take care of your child. That will never change. It might look a little bit different among COVID-19, but that will never change. Please do not hesitate to call your doctor's office, use MyChart messaging, or even our online urgent care visits if you have any needs. Thank you for watching, and keep an eye out later this week for a conversation we're going to have with one of our primary care doctors. Thank you.
Thank you.